Thank you for joining us today. Would the clerk please take the attendance?
Chair Miller.
Here.
Reps Pais.
Present.
Young.
Here.
Kofia. Conlon.
Here.
Dievendorf.
Here.
Fitzgerald.
Here.
Reingens.
Here.
Nyer.
Here.
Vanderwall.
Present.
Roth.
Here.
Beerline.
Here.
Smith.
Present.
Madam Chair, you have 12 members present, a quorum.
All right, thank you. Today we will be considering House Bill 4849, which is a bill from Representative Kolazar, also known as Queenie's Law. We'll be voting that out and hearing about the substitute. And also HB 4980, which is a bill from Representative Pahutsky, which is a tele-vet bill. We will start with 4849. Representative Kolazar, please, would you like to join us at the presenters table to speak to your substitution?
Thank you, Madam Chair, and thank you to the Vice Chairs, members of the committee. It's good to see you all again. What this substitute does is two basic things. One, the substitute no longer applies to dogs and cats. It's only to dogs. And it also no longer applies to private institutions, only public institutions. So just dogs at public institutions. And that's the change.
All right, thank you. Rep. Heiss moves to adopt H1 sub for HB 4849. Clerk, would you please take the roll?
Chair Miller.
Yes.
Representatives Pais.
Yes.
Young.
Yes.
Kofia. Conlon.
Yes.
Dievendorf.
Yes.
Fitzgerald.
Yes.
Reingens.
Yes.
Nyer.
No.
Vanderwall.
No.
Roth.
No.
Beerline.
No.
Smith.
No.
Madam Chair, you have 7 yeas, 5 nays, 0 pass. The motion prevails.
Thank you. Would Dr. Michael Bradley from Wayne State please come up at the presenters table? You have 2 minutes, and please speak to the substitute.
I'm here virtual. Can everyone hear me?
Yes.
Yes. Okay, great. Yes, my name is Michael Bradley. I am the Senior Director at the Division of Laboratory Animal Resources and the attending vet at Wayne State University. In that role, I am also specialty board certified by the American College of Laboratory Animal Medicine. So I'm here to testify against the passage of HB 4849 and to present the value of the canine research work that's been performed at Wayne State. I know in previous hearings, the conversation on this bill has centered on a variety of the current and legacy work performed at Wayne State. So we find it prudent to present the program of animal care to the committee. Certainly recognizing the 2 minutes that I have, I'll kind of jump to conclusions that have come from the research, because that's been a point of emphasis from some of the proponents of this bill. So we would like to present the current body of canine research at Wayne State, which aligns with our high animal standards. Currently, there are approved studies that utilize the canine model for the study of cardiovascular physiology in the context of heart disease. And this work has been funded by the NIH continuously for over 30 years. And I'd like to note that the NIH funding is highly competitive, and often less than 20% of submitted proposals are funded. To me, this demonstrates that a team of experts in cardiovascular physiology deem this work to be worthwhile. And in my opinion, it is important to trust their specialized expertise on this topic. Over the 30-plus-year history of this research at Wayne State, there have been numerous scientific advancements that have added to the body of scientific knowledge on cardiovascular physiology. These findings include the development of the Barostim system, a treatment geared at improving exercise capacity for heart failure patients. Additionally, we have contributed to guidelines and measures to prevent anesthesia-induced hypotension during surgery, guidelines for norepinephrine weaning in septic shock patients, and cardiac rehabilitation guidelines related to the use of blood flow restriction training. In summary, this work has greatly improved our understanding of exercise intolerance and heart failure, as well as many other medically relevant basic science discoveries. This work is performed under the watchful eye of a team of board-certified and highly qualified professionals, and in totality, our program of animal care at Wayne State is well regarded and exceeds all regulatory and accreditation standards. To conclude, we find this bill, HB 4849, to be overly restrictive in that its passage would prevent impactful work like the aforementioned from being completed. Current dog research is already heavily scrutinized by internal IACUC committees and overseen by various national and international agencies. Moreover, we envision that there would be many unintended consequences from the passage of this bill as it relates to preventing future research that could benefit both human and veterinary medicine. and additionally would portray the state of Michigan as cultivating an anti-science legislature. And I thank you for your audience with the committee.
Thank you. Are there any questions? Yes, Rep. Vanderwall.
Thank you very much for your testimony. A real quick question with this bill and the potential passing of this bill. Can you tell me what the economic outcome, or has any study been done on an economic outcome for the state of Michigan when it comes to research like this?
It'd be hard to come up with a number offhand. I know this is a small segment of research. Obviously with the change in language to just focusing on dogs and public universities, there's really just a few places that this would impact, but it would be impactful, right? I know we perform studies. I know Michigan State performs studies. It would greatly affect those researchers and really that whole research program.
Thank you.
Are there any other questions? Thank you. Next, we'll have Amanda Hagan, who wishes to speak, who is opposed to the bill. Amanda, you please come up. You have 2 minutes, and please speak to the substitute.
AHI is the trade association.
Can you press your button?
Sorry. Can you hear me now? Sorry about that. My name is Mandy Hagan. I am Director of State Affairs for the Animal Health Institute. AHI is the trade association representing manufacturers of animal medicines, the drugs that keep animals healthy and help them live longer lives. We are committed to replacing animals used in research where alternative test methods are available, reducing the amount of experiments done and the number of animals used, as well as refining the methods used. But we are in a unique situation as the animal health industry in that our intended beneficiaries of our therapies are animals, and often dogs. And so testing on dogs is something that is required by federal agencies, and we would have to continue to do that. And that's our concern with this bill. And the substitute is also, while it doesn't impact directly members of AHI, we work in cooperation with public institutions as well. And our concern is the chilling impact that it would have on all animal research in Michigan as well as across the country. So happy to answer any questions.
Do members have any questions? Okay, without any questions, I'll move on. Thank you so much for your testimony. I will now read in the cards. So, Holly Toms from Capital Area Humane Society, not wishing to speak, supports the bill. Bonifer Ballard with Michigan Veterinary Medical Association, not wishing to speak, is opposing the bill. Valerie Shea from Traverse City, not wishing to speak, supports the bill. Stephen Rapundolo from Ann Arbor, not wishing to speak, is opposing the bill. Michigan Bio, he's from Michigan Bio, and not wishing to speak, and who opposes the bill, Nancy McKee from Zodas. Thank you, everyone. Rep. Young moves to report the bill. Hearing no objection, will the clerk please take the vote?
Chair Miller,
Yes.
Representative Faiz,
Yes.
Young,
Yes.
Kofia,
Yes.
Conlon,
Yes.
Devendorf,
Yes.
Fitzgerald,
Yes.
Reingen,
Yes.
Nyer,
No.
Vanderwall,
No.
Raw,
No.
Beerline,
No.
Smith.
No.
Madam Chair, you have 8 yeas, 5 nays, 0 pass. The motion prevails.
Thank you. At ease? All right. Changing of the guards? Now come to order. We will be moving on to House Bill 4980, which is Rep. Pohutsky's televet bill. Please come to the presenters table. Welcome.
Good morning.
Madam Chair and members of the committee, and thank you for hearing testimony on House Bill 4980, a bill to allow for veterinary telehealth in the state of Michigan. The use of telehealth expanded during the pandemic, and veterinary medicine was no exception. Due to emergency orders allowing for flexibility regarding defined patient-doctor relationships, pet owners were able to have their pets visit a veterinarian for non-emergency needs from the comfort of their own home. The benefits of this extended well past the pandemic, but unfortunately that flexibility has ended. House Bill 4980 would increase the access of veterinary medicine to pets who otherwise might not be able to receive it for a variety of reasons. The increased cost of an in-person visit may be a burden for some pet owners. This is also a particular burden for shelters. Additionally, some pets find in-person visits to be incredibly stressful, particularly if they have a chronic illness that increases the frequency with which these visits must occur. For example, this is Delilah. Delilah is my 14-year-old calico cat. If you know anything about calicos, they're butt heads. They're very attitudinal. When I adopted her, I was told that she had Bartonella, which is an intracellular parasite that she would have for the rest of her life, and it would create a myriad of health issues. The most profound one is that due to gum inflammation caused by her illness, Delilah has had to have all of her teeth pulled. This took place over several years and several vet visits, and while her quality of life has drastically improved, the trend of going to the vet and leaving with fewer and fewer teeth resulted in understandable dislike for trips to the vet. Now, in her golden years, Delilah frequently develops upper respiratory infections that require antibiotics. They're not a big threat, but they do require just a course of treatment. Her vet's aware of this. We have the routine pretty well established, but due to current law, each of these infections, minor as they are, require a trip to the vet. Despite my best efforts to explain to Delilah that she has no more teeth to be pulled, and this will not be as traumatic of an experience, she doesn't seem to understand that. And sometimes it takes days for her to return to normal when she gets back home after one of these routine visits that doesn't actually require an in-person examination because we all know what the root cause is. It just needs a simple course of antibiotics that I could pick up without taking her with me. HB 4980 allows for the flexibility for veterinarians to use their best judgment regarding whether or not an animal needs to be seen in the office. I want to be clear about that. Veterinarians get to make the call as to whether or not a pet needs to come in. It also limits the use of telemedicine to companion animals to ensure that any animals that could enter the food chain are being seen in person. This was a change from a previous iteration of this bill. Another change is that the bill does not permit the prescription of controlled substances as a result of a telemedicine visit, ensuring that pet owners are not taking advantage of these visits to obtain such medications. Additionally, non-controlled substance prescriptions may be issued, but only for 14 days at a time before another visit. Another prescription may be issued, and then that's it. A pet must come in for an in-person visit if a problem persists. It's important to note that this bill is not meant to have veterinary telemedicine completely replace in-person visits. Pets need to be seen for vaccinations and for emergency situations. But I also think it's important to be honest about the fact that pet owners who would not take their pets in person under this law are not doing so now. The only difference is that the law as it stands today prevents those pets from not just receiving precautionary care, but it also prevents them from seeking medical attention for routine ailments that could be diagnosed and treated via telemedicine. HB 4980 would help address this problem, and I hope that for this committee's support. With that, I am happy to take any questions.
Are there any questions? Representative Nyer, go ahead.
Thank you, Madam Chair. My question is, theoretically, if you don't have a history with that vet or a vet, you can go on telemedicine and get a prescribed treatment or diagnosis, or do you have to have a history with that particular vet in person?
Under the bill as it's written, it's up to the vet's discretion. So if if an animal perhaps doesn't have a doctor-patient relationship, for lack of a better term for animals, the vet can decide whether or not the situation is such that they can, again, for a situation like shelter pets or someone who possibly moved, the vet can determine whether or not they feel comfortable issuing a prescription, but it also does not mandate that. If a vet determines, no, I need to see this pet first, I need to get a baseline assessment, they can require that. There's nothing preventing either one of those paths forward. It's at the vet's discretion.
Thank you.
You're welcome.
Are there any other questions? Yes, Rep. Copia.
Thank you, Madam Chair. Thank you, Rep. So I wanted to understand what, if any, impact this has specifically on animal shelters. And
So-
if you could speak to that.
We have some shelters that are here to testify as well, but it's worth noting that shelters are frequently operating on kind of shoestring budgets, and they have veterinary staff in place, but there are also instances where telemedicine would be incredibly helpful, particularly when we talk about that doctor-patient relationship, because this is an animal that is hopefully at that shelter temporarily. They're not really going to be establishing a long-standing relationship with a veterinarian, because hopefully they're going to find a forever home and be able to establish that relationship with a vet of their own. But you're going to hear from some shelters about why this would be a huge help for them, but it really comes down to the budgetary aspects of in-person visits and the length of stay for those pets or for those animals in that shelter.
Any other questions? All right. Thank you.
Thank you.
Next, we will have Dr. Courtney White, who is the Vice President of Veterinary Medicine for the Humane Society of Huron Valley. Dr. White, will you please join us? Thank you. Make sure your mic's on.
Good morning, Madam Chair and Committee. Thank you so much for having me. My name is Dr. Courtney White. I'm the Vice President of Veterinary Medicine at the Humane Society of Huron Valley in Ann Arbor. We are the second largest animal shelter in Michigan, serving over 14,000 animals annually and the people who love them dearly. In addition to providing shelter and care for the homeless animals in Washtenaw County, our organization operates a full-service outpatient veterinary medical and surgical clinic serving the community. We are in a unique position to be able to serve and support a large community with a wide range of socioeconomic statuses and geographical regions. Individuals experience personal hardships, and above all, owners that love and advocate for their pets. Today I stand before you, or sit, I guess, to share my support for a critical piece of legislation that holds the potential to transform the landscape of veterinary care as we know it. This bill, designed to provide veterinary telemedicine and eliminate the requirement for an in-person veterinary client-patient relationship as a prerequisite for telemedicine, is not just about embracing technology. It's about expanding access, improving efficiency, and assuring that every pet owner can receive timely veterinary advice and care. The advancement of digital technology has transformed various sectors, including healthcare. Veterinary medicine is no exception. The traditional requirement for an in-person veterinary client-patient relationship before providing telemedicine services is being challenged as telehealth becomes more prevalent. Eliminating this requirement could enhance the quality and accessibility of veterinary care. I can come before you today and offer a very unique perspective as a shelter veterinarian, where we also employ 9 veterinarians total within our organization. I have been in the veterinary field for almost 30 years and a licensed vet for 15. Our organization has been able to provide care above any other that I've been able to experience in my career. At our shelter, we have numerous departments that work 7 days a week, and our cruelty rescue department works 24/7. I, as the shelter veterinarian, am on call 24/7. So I have had to triage animals through phone calls, text messages, videos, and I can say that I have been able to safely, effectively, and efficiently provide care for thousands of animals annually. Being able to have that access and being able to provide that care. I'm in a unique position because those animals are not client-owned. They are our animals, technically, within the shelter. However, that is an opportunity and experience that many pet owners would be able to benefit from. Many pet owners in rural or underserved regions face significant challenges accessing veterinary care due to distance and limited availability of veterinary services. Telemedicine can bridge this gap by allowing veterinarians to provide consultations, diagnosis, and guidance without the need for travel. Pet owners with mobility challenges, disabilities, or lack of transportation can benefit from telemedicine. It offers a convenient alternative to in-person visits, ensuring that pets receive timely and necessary care. The United States is currently facing a significant shortage of veterinarians, a crisis that's affecting timely delivery of essential medical care to animals across the nation. Eliminating the in-person requirement allows for veterinarians to conduct initial consultations and follow-ups more efficiently. This can lead to reduced wait times for appointments, benefiting both clients and veterinary practices. As the costs of veterinary care continue to increase, necessary medical care is becoming cost prohibitive for many pet owners. Virtual consultations often cost less than traditional visits. By removing the in-person requirement, clients can save on travel expenses and time, making veterinary care more affordable and allowing their pets to receive the care they need. Veterinary medicine has evolved significantly over the years, expanding its focus from solely attending to the physical well-being of animals to also considering their mental and emotional health. This approach recognizes that animals, like humans, experience a range of emotions and that stress and fear can have a detrimental impact on their overall health. As a result, fear-free approaches have gained popularity within the field. Fear-free veterinary care is an approach designed to reduce the stress and anxiety that pets experience during veterinary visits and when receiving medical care. Telemedicine naturally complements the fear-free approach by providing a familiar and stress-free environment for pets, eliminating stressful travel, enhancing owner communication, and allowing a unique personalized window into the pet's home environment and surroundings. The elimination of the in-person veterinary client-patient relationship requirement for telemedicine in veterinary practice presents numerous benefits, including improved access to care, increased efficiency, economic advantages, and the utilization of advanced technologies. By embracing telemedicine, veterinary practices can provide more inclusive, timely, and effective care for pets, ultimately enhancing the health and well-being of animals and their owners. Therefore, it's imperative to reconsider current regulations that restrict an owner's access to medical care for their pet and minimize the autonomy of the licensed medical professionals. Adapting these regulations with modern veterinary practices and embracing technological advancements, we can create a more effective, responsive, and compassionate veterinary care system for the future.
Thank you for your testimony. Do we have any questions? Yes. Rep. Heiss, please go ahead.
Thank you. I just was curious about how a shelter can do evaluation by telehealth on intake, just because generally when you have a pet owner, they can tell you what the situation is, but if you get something in the middle of the night, let's say, how do you really know?
Well, so we have well-trained intake staff and well-trained cruelty rescue investigators, and they are able to relay to me the information that I need to make an appropriate decision on what may need to be done to either stabilize that animal, initiate treatment. As from my perspective, in the years of experience that I have, having hands-on is not always necessary. I can gain a lot of information by visual, by pictures, by videos, by asking questions of the people that are present with that animal. And I can make informed and well-educated decisions on initial care and stabilization for them.
Representative Vanderwall.
Thank you, Madam Chair. Appreciate it. Just curious, reading through this, just a real quick question. People that are allowed to do telehealth for dogs and companion animals, are they just in-state veterinarians, or are we going to allow out-state?
At this point, I believe it would just be within state, because across the board, to practice veterinary medicine outside of your state, you would need to be licensed in that state. Okay, so even to provide treatment for an animal in Ohio, I would need to be licensed in Ohio.
Are there any other questions? Representative Young.
I'm sorry, maybe for the bill sponsor as well, Representative Pahutsky. So we're just looking at this, and it says the proposed legislation does not apply to the companion animals, but your testimony dealt with your cat, which in my in my thinking, is a companion animal, but then we also have service animals. So I want to be clear. Is it right?
Companion animals are defined elsewhere in the statute. So service animals count as companion animals. Companion animals mean things outside of like livestock, food things. So companion animals are, going to be like your dogs, your cats, your guinea pigs, whatever floats your boat in that realm. But it excludes like farm animals, livestock, things that might enter the food chain.
There's just a note that we have that says the proposed legislation does not apply to companion animals. And so that's what's throwing us off. It could just be a simple human error, but we want to be clear. That's not what it should say.
The bottom of page 1 of the policy brief, Rep.
Oh, well, if you read the book, that's not what it says. Or I'm sorry, the bill, that's not what it says. It's inverted. So the policy brief may have a typo, but the bill only applies to companion animals.
Only applies.
Yes, it excludes anything outside of companion animals.
Thought, but we wanted to clear it up before
it's an important typo, so thank you for flagging it.
Thank you.
Yep.
Are there any further questions? All right, we'll move on to our next presenter. Thank you, Dr. White. Next, we will be hearing by virtual testimony from Dr. Cheryl Good, Chief of Staff and practicing veterinarian at Dearborn Family Pet Care in Dearborn, Michigan. Will Dr. Good please join us?
Yeah, good morning. Can you hear me?
We could use some volume on that.
Let's see. Can you hear me now? Can you hear me?
Yes.
Okay. Good morning, Madam Chair and committee. I'm Dr. Cheryl Good, licensed veterinarian in Michigan. I have been a veterinarian for over 35 years, owned my own practice for quite a long time. Was also the medical director for the Friends for Animals of Metro Detroit for 25 years, and a lot of other things. But one of my passions is telemedicine. I started to do some telemedicine before COVID broke out, with my own clients, and the term would be VCPR, veterinary client-patient relationship. So I was having telemedicine, doing telemedicine with my own clients. But when COVID hit and we were allowed to, bring in new patients via telemedicine, I embraced that as well. There were many clients who we hadn't seen before, many patients and clients, and in order sometimes for them to get information about their pet, get help for their pet, I was able to do video calls that also I could see the animal in their own environment and help them with a lot of situations. Telemedicine, of course, isn't for every case. There are many times when I am, consulting with a client and I see the patient, they tell me what's happening, and I say, okay, this is not a telemedicine appointment. You need to either go to an urgent care or you need to go to the ER because they need to see the patient. But there are so many situations where you don't have to see the patient. Specifically dermatology, a lot of dermatology cases at the beginning, you can see don't have to lay hands on it. You just can see pictures. There may be a rash, there may be a lump or bump. Sometimes those lump or bumps can turn into, oh, that's not a bump, that's a tick. So at least the first, visit with this patient for those specific types of things can be done over video very easily. And, I've been saying you have to trust your vet. Your vet is trained to know what, they can do from afar and what they can't do from afar. And we used to do telemedicine, I guess you would call it, just over the phone for years and years and years, talking to clients that we hadn't seen their patient, giving them advice. Now we have, the ability to see them in their home environment. There are some patients that are so afraid to come into the vet they need to have some type of medication to calm themselves down to be even able to come in for us to lay our hands on them. There are some patients that even with that medication, we can't lay our hands on, but we still want to be able to help them. So I've seen many cats that have come into my practice where they are so afraid that I can't even touch them unless they're anesthetized. And in certain cases, that's not even healthy for them. So I'm basically kind of standing from afar, looking at the patient, talking to the client, and that is developing the veterinary client-patient relationship. But I could do the same thing, maybe even better, looking at them on a video or doing video teleconferencing in where the cat's in their own home. I can actually see them walk around. I can see if they're limping. But if they're in my hospital, sometimes they're hiding in a corner. I can't even get them out of the corner to see what's going on. So in many cases, telemedicine is even better than an inpatient visit. You know, certainly there are things that I can't do. I can't right now. I can't listen to a heart. I can't palpate an abdomen. But certainly if, say, an animal has a urinary tract issue, they'll come in, I'll palpate the abdomen, but sometimes I'll say, you know, I really need to get some x-rays. We need to get a urinalysis, you know, those kinds of things. So we can't do x-rays right now. We can't do testing, vaccines, you know, over telemedicine. But at least to initially establish that client-patient relationship, veterinary client-patient relationship, I feel that, you know, we can do that over telemedicine and then recommend that they come in to see us. But we can do initial things for them. We can say, you know, this, you know, I'm going back to the dermatology, like a rash or something, you know, ask questions. Is the patient itchy? Let me see what that rash looks like. Yeah, it does look like it could be bacterial, certainly without testing it. I can't tell you 100%, but we can try, you know, giving your dog or your cat, you know, an anti-itch medication. We can try giving some antibiotics. And then I want to schedule you an appointment to come in to recheck that, you know, in 10 to 14 days. So there are just, you know, so many things that we can, you know, help our patients, our clients with over telemedicine that I don't need to see them in person. And I would recommend if I do, then, you know, have them come in. Gait is, you know, assessing their gait, assessing, you know, how they're breathing, assessing how their skin looks, and behavior consultations as well. You don't have to have an in-person visit for that. So thank you very much for your time. I'm wholly in favor of this bill.
Any questions? All right, thank you so much. Oh, I'm sorry, I'm sorry, Representative Nyer, please go ahead.
Thank you again, Madam Chair. What is preventing you from just having those phone conversations and those teleconversations now? Is the law explicitly preventing you, or have you already been able to do this, especially with established patients?
So right now, I can do that with my established patients. I cannot legally do that with either with clients and patients I haven't seen before, or say I have seen this patient before and it's been over a year or so. I believe the law right now says they still have to come into the hospital. But right now I can only do it with those patients that I have seen in hospital at least once in a year.
Thank you.
Are there any further questions for the doctor? Thank you again for your testimony. We appreciate your time today.
You're welcome.
Next, we will have finally a hearing testimony of Jen Hopgood from the ASPCA. Will Jen please join us at the presenters table? Good morning. Make sure you turn your mic on.
Good morning, Madam Chair and members. My name is Jen Hopgood. I'm Senior Director of Access to Veterinary Care Policy for the ASPCA. And I just wanted to stop in real quickly and kind of try to wrap this up. I know you've heard a lot already, but There's a critical workforce shortage in the veterinary profession right now, and people, pets, shelters are struggling to get access to care. We've seen in human medicine how telemedicine can bridge those gaps in care by providing an alternative method of delivering care. We saw it in the pandemic. We've seen it coming up decades. Luckily, we had that infrastructure in place when the pandemic hit so that we could continue to get care while safeguarding public health. So it's really important that we extend this to our veterinary professionals as well. We know that about 1/3 of pets right now are not receiving regular veterinary care, 1/3. And there's a project called the Veterinary Care Accessibility Project. It's a national organization that has taken data from the CDC, the US Census Bureau, the AVMA, and others, and they've compiled an access to care score for every state in the country down to the county level. So you can get your county scores. Michigan, out of 100, scores a 50 right now. So we're literally failing the animals and the people who own them in this state right now with a score of 50. And the other thing that's interesting about this Veterinary Care Accessibility Project is they have a website that talks about veterinary care deserts within a desert. There's a whole page of their website devoted to this idea of deserts within a desert. And the one county out of all the counties in the country that they chose to be demonstrative of a veterinary desert within a desert, Wayne County, Michigan. There is a whole page dedicated to explaining how Wayne County is demonstrative of a veterinary care desert within a larger desert in the country. And that's the one county they chose to demonstrate that. So we can do better. We can do better than the status quo, than what we've always been doing. We've heard unfounded arguments against this in other states where we've worked on this issue, and I've been working on this since 2020. And, 2 states that don't agree on anything, literally, Florida and California, have agreed that veterinarians can initiate relationships with patients over telemedicine, with lapsed patients, with new patients, that they can be trusted to use this. So it's not a partisan issue. It has broad bipartisan support. Those bills in California and Florida passed unanimously. That doesn't happen often. So this increasing access to telemedicine helps everyone. It helps that those folks who live in areas, rural areas or urban areas that are underserved by veterinarians that don't have enough vets. But it also helps people like those of us in this room who probably have a regular vet for our pets, but we have stressed pets. We have a spicy little terrier that's going to bite the vet, or a cat that might really be unhappy about being there and not cooperate. After hours, we'd love to be able to connect with a licensed veterinarian at midnight when Fluffy is sick and we need to know, do I need to go to the emergency hospital and pay $1,200, or can this wait till the morning when I can go see my regular vet, and be told that by a licensed veterinarian, to have that access right there. And, just to get a second opinion, if we want a second opinion to connect with a new veterinarian, or get a treatment for a specialist through telehealth, or just to have the convenience in this modern world, having the convenience of not having to carry our kids to the vet clinic, take time off work, pay for transportation if we don't have it. It helps senior citizens, who may have mobility challenges. There are just way more reasons that I can go into today that we need to do this. So it helps shelters, it helps vets, it helps animals. And the last thing I want to leave you with, 2 things. We heard, well, animals can't talk, and of course that's true. They don't talk when they get to the clinic either. They don't start talking when they get there, and neither do the 6-month-old children. People are now using telemedicine for themselves, for their children, and it works. We trust these professionals who are licensed in the state to tell us, I can't treat that over telemedicine, you're going to have to bring them into a clinic, or yeah, let's try this. So the last thing I want to leave you with is this bill is an important policy switch that you can flip. When it's signed into law, right away, people have better access to vet care right through the phones in their pockets. And that's a really important thing that we need to go ahead and let our veterinarians do. So thank you for your time.
Thank you. Are there any questions? Representative Young.
Okay, first let me just say thank you for your enthusiasm. Clearly you are passionate about this. I'm curious to know, do you have any data on the number of people who have been unable to get their pet, their loved one, to the doctor because of lack of transportation? Because that's huge. Even if you had the ability to pay or something, you still can't get there because you can't take them with you on the bus because they're not a service animal, those types of things. So I was curious about that.
Representative, thank you for that question. Yeah, that is one of the major barriers because it's not just folks that don't have transportation, maybe they don't have a car, but you can't put a cat on or a dog on public transportation often. So not only taking time off work, I'm not sure transportation specifically, but we know it's a major barrier to care. Just like affordability is one of the biggest, not just for preventive care, but for the urgent needs of their pets. And that point was made earlier that, if we're not able to get the veterinary care to them, I think there's an aspect of this that is, it troubles me a lot because basically we're saying that if this 1/3 of pets, if their owners can't get to a veterinary clinic, they don't deserve to access veterinary care. I mean, that's kind of what we're saying when we say, sorry, you got to bring them in person or that's all you get, even in this modern age where we have access to technology. So yeah, folks without transportation is a major group and large animals. Some people like my size, if I had a 100-pound dog, I could get that dog into a car if they had mobility issues or, there's just so many reasons. Thank you, Representative.
Representative Kafia.
Thank you, Madam Chair. And this is less of a question, more a very quick comment to agree with what you're saying and to thank Rep. Pohutsky for bringing this forward. One, we have had enormous a wave of people having to surrender their pets back to shelters over the last several years, particularly tied to the housing crisis. And for me, when I think about somebody who's just barely hanging on financially, that pet is family. And so if this allows them to actually have access to care and save on vet bills and travel and things like that, I think that's a great thing. So thank you.
Madam Chair, if I may, that is housing issues, affordable housing, and access to veterinary care are the top 2 reasons that animals are surrendered to shelters. And we really want to keep those. That pet wants to stay with that family. They don't care what your tax return looks like. They love that family, and that's something to be honored. And we should be able to help those people keep those pets with them rather than, I had a senator in another committee say, sometimes that pet just gets buried in the backyard and we just move on because we have to make the rent. We have to pay the bills, and there's only so much money to go around. So absolutely, that's why you see shelters in support of this here and nationally.
Are there any other questions? All right, thank you so much for your testimony. Next, we will be hearing from Boniford Ballard and Dr. Robert Fish. They're wishing to speak who are opposed to the bill. Please keep your comments to 2 minutes. Please come up and join us at the presenters table. Good morning.
Good morning, Madam Chair, committee members. Thank you for having us today. My name is Boniford Ballard. I'm the CEO of the Michigan Veterinary Medical Association. We represent about 2,300 licensed veterinarians throughout the state of Michigan. We are opposed to the bill before you as presented. However, I'd like to acknowledge Representative Pohutsky. We've been in dialogue with her about some changes that we'd like to see in language. We are not against telehealth, telemedicine. We just have we want to make sure that VCPR is established. Dr. Fisher?
Yeah, I want to just comment a little bit more here. First of all, I'm Dr. Robert Fisher. I've been a veterinarian for 46 years now in private practice and shelter medicine as well. So I have some background there as well. As Bonifer has mentioned, I'm with the MVMA. I'm currently the chair of the Legislative Advisory Committee. And one of the biggest roles of the Michigan Veterinary Medical Association is to advance the standards of veterinary care for all animals. And that's really why we have a major objection with this particular bill as written. We are firmly in the belief that the veterinary patient-client relationship requires an in-person visit to the veterinarian as order to establish that relationship. As I said, we're not against telemedicine. We just think it can be refined in order to fulfill that particular need. That is pretty much the gold standard in veterinary medicine currently. Many organizations, many states feel that's appropriate. It's in their laws. LARA has that regulation in Michigan currently. The AVMA is also in favor of that examination to establish the veterinary client-patient relationship. It's important to kind of highlight really the reasons for that. And just very briefly, it was what mentioned already, animals aren't able to speak clearly. And to rely on clients or lay people to accurately relay what is going on with a particular pet is not reasonable in many cases. And although a human patient can describe to a physician accurately what they are experiencing, many times that's going to be misinterpreted by a client what an animal may be experiencing. Animals manifest disease in different ways than people do. So right off the bat, we're concerned about communication issues, getting a clear picture of what's going on. And really, a physical examination complements the decision-making process and arriving at a potential diagnosis. Even in many of the examples cited, you heard some comments about, well, may need a urinalysis on this, or I can see a gait. Well, you can't examine a gait over the phone. That requires an in-person exam. So that's very important. And again, why we feel it's appropriate as far as an exam to interpret things. So we feel very strongly that this standard is appropriate. It's important to obtain an accurate diagnosis, to reduce potential errors in diagnosis and treatment, and certainly for the safety of the patient as well as far as going forward.
Thank you. We appreciate your testimony. Representative Kofia.
Thank you, Madam Chair. I just wanted to clarify something. It's Boniford Bennett?
Bonifer Ballard.
Ballard, thank you. So we were talking about hands-on care being important. Am I remembering correctly that you had submitted a card in support of continuing painful animal testing on dogs in the last bill that we just voted on? Was that you that submitted the card supporting continuing that practice?
We're actually in favor of the current regulations that govern that practice. So we're always for the welfare of animals, and we rely on the integrity of veterinarians to make sure that what they're doing is following the rules that are established by their committee.
Sure. And with respect, we heard testimony months ago about what current standard allowed practices, which is things like putting a wire through the back shoulders of an animal, keeping them alive. They do experience a lot of pain. And I said then what I will say now, which is if you would be willing to subject yourself or your pet to that, that's one thing. But I really object to the idea of continuing that practice. And I think it's noteworthy that you support continuing it.
Thank you. Representative Young.
Thank you. Thank you all for your testimony. Just a quick question. So we talked about the vet-patient-client relationship and how important that is to you, and that's one of the things that you wanted to see. So I want to be clear about that relationship. Are you saying that when your pet comes in for a wellness check, at that point you're establishing a relationship, correct? So once that wellness check relationship has been established, 3 months later, that pet experiences some issues. Do I now still have to come back now that the relationship has been established, or am I now able to go ahead and utilize telemedicine?
You would be eligible to participate in telemedicine if that.
So your concern, because your testimony has simply been around perhaps a pet that's experiencing some type of difficulty, some type of illness or an injury. At least that's what I've heard you talk more about. And that was your concern, not being able to diagnose or triage of that animal because there hadn't been a relationship established. But if it's already been established when the pet was healthy, but you're going to be okay with the pet receiving telemedicine now that it's under the weather, I'm not real clear where you're getting that from.
So the establishment of a VCPR could be, in an ideal situation, would be available within a reasonable amount of time of that telemedicine visit. Right now, the law requires that in-person visit before a vet can do any kind of telemedicine diagnosis or treatment. The language that we've been working on with Representative Prohibits would actually allow for a telemedicine visit requiring that VCPR be established in a reasonable amount of time. So if that language were to change in the bill, we would turn from opposed to support. Did that answer your question? Okay.
Thank you. We need to move on. Thank you very much, both of you, for your testimony.
Thank you, Madam Chair.
Next, we have Larry Dumm with the American Vet Medical Association wishing to speak, who opposes the bill. Please come up to the presenters table. You have 2 minutes to speak. Thank you.
Thank you very much, Madam Chairperson and all of the other members of the committee. I have a very unique perspective in veterinary medicine because I personally wrote the very first VCPR bill here in the state of Michigan, and I served on the State Board of Veterinary Medicine with an esteemed colleague of yours, Hank Vopel, who wrote the very original VCPR, which was in the original veterinary rules. I also have worked on this for well over 25 years. My major concern with this bill is not the use of telehealth. Telehealth has been used in veterinary medicine for the last 40 years, ever since the phone came along. I've been a veterinarian for 40 years. We are basically opposed to this bill in the part that there does not need to be any type of exam of an animal before someone can diagnose and can treat an animal. You have to think about the public health aspect of veterinary medicine too. Small animals, companion animals, dogs and cats also carry zoonotic diseases. If we do not examine that dog or get some type of relationship and understand that, there is a potential for zoonotic diseases to be spread within the state. A prime example that all of you on this committee are aware of is highly pathogenic avian influenza. You may not know that cats can be a carrier of highly pathogenic avian influenza. If someone calls me up, they have a backyard flock of birds that have not been tested, they have a cat that's outside, and that cat is a carrier, he could take that to a particular facility and spread that disease if they're standing next to a, if they're living next to a farm where there are thousands and thousands of chickens. So we have an economic problem with this. We also have a potential issue that happened in Oregon well over 3 years ago, where a rescue group brought in 50 dogs from the country of Azerbaijan, and there was no examination done to those dogs. 45 people had to be treated for rabies exposure, costing the state well over $500,000 to treat those individuals. I read a story last night about a veterinarian who started using telehealth. They had no concept of what kind of condition the dog was in. They the owner said, my dog's had chronic diarrhea. They had a record from another veterinarian that they read that this dog had been prescribed diarrhea medicine for well over 10 years. So he took it upon himself. He got as much information that he could from the client. The problem with this was he prescribed that medication as this bill would do, and what happened with that particular situation was this dog did not have diarrhea. This dog suffered for well over 28 days. This dog had a prolapse rectum. 10 inches of his colon was sticking out of the colon of this dog, and also his prostate gland. The owner did not tell him that this situation had occurred. They never saw it because the dog was so poorly taken care of that it was matted. That dog suffered for 28 days till they brought that dog into the facility, and that dog unfortunately had to be humanely euthanized. Writing through this particular situation and with this bill, we would like to have it modified. We are not against telehealth. Telehealth is important. That exam is extremely important. I also would like to say that when I wrote the very first bill, that unfortunately due to COVID and some other problems that had come along, we were the first state in the union to give an exemption to shelters. There is no other state in the union that has an exemption for shelters. We also had an exemption for emergency care. And when I say emergency care, that's not an animal under an emergency situation. That is an emergency, whether it's financial, whether or not it's the ability to get there, with the information on there stating that it is up to the veterinarian's discretion to get that animal into the facility as soon as possible. So there are alternatives that are better. And I just want to say that the standards are set by the State Board of Veterinary Medicine, and it is currently in our rules that you must do an exam or be familiar with the area where the animal is housed. That is the national standard. There are 37 states that is what the current law is. Thank you for your time.
Thank you. Are there any questions? Yes, Rep. Pice, please.
I'm wondering then, do you disagree that the veterinarian then can't say, listen, I'm doing this telehealth visit, I think it's this, here's a prescription, I need to see you within the next week? Because it seems to me that would be perhaps the mindfulness of the veterinarian, and also when it comes to the 500 or 50 dogs or whatever, that would be more of a federal law about, I forget what the word is, but isolating the animal before they come over. So that really wouldn't be the problem there. That would be the federal law that needs to be looked at.
Please repeat your question for me. I kind of went.
No, I understand. So, let's say I just moved to a new town.
Mm-hmm.
I noticed my dog is having this problem. I'm up here in Lansing, but, the person watching my dog is elsewhere. So let's say that person calls a local vet. Are you saying then that vet could not say, listen, I'm giving you a prescription for right now, when Veronica gets back into town, I want her to bring the dog in? It seems to me that would be not unreasonable, and for a veterinarian to not follow up that way then might be a lack of mindfulness on the part of the veterinarian.
Well, just like there's good doctors, there's good veterinarians,
Right.
There are bad veterinarians.
Right.
So it makes it hard to do that specific case. It would depend on the animal, and it also depends on what that person has seen. The owner of the animal would know more than someone that is watching that particular animal. If that person is not watching that animal properly, they may not know the history. They may not know what's going on. So as a veterinarian, I would be hesitant to prescribe some particular medication without knowing, especially if it was a new veterinarian that had not seen that animal before.
So I would have to go back to Lansing, or leave Lansing.
No, you
let's
could
say,
you
go
could
back and then bring the dog in.
You could try to get into whatever veterinary office that was available to you. Just to let you know, as far as accessibility to veterinary medicine, there are 12 to 15 new veterinary colleges coming online and there are major efforts in order to help with the veterinary shortage. There will be 3,000 to 4,000 new veterinarians coming online every year for the next 10 years with the new veterinary schools. There are also programs on a national basis to provide access to care and having individuals put into rural areas in order to help with the veterinary shortage. There's a lot more going on than most individuals are aware of. Did that answer your question properly?
Not quite. You answered it correctly.
Unfortunately, any type of medical profession, there's a lot of differences on what can and what can't be done.
Right.
Okay. In that particular case, you're saying someone watching someone else's dog. The best way for that particular person that I would say is, talk to the regular. If there's an already established relationship.
But if there's not, that's what I'm saying. Somebody just moves to town, has to be up here in Lansing for a job. I've got somebody watching my dog down there. We think something's going on here. I can't make it down to describe the situation, or I can't make it down there to take the dog in.
Mm-hmm. I think an examination, I think since that person's not aware of that, an examination by a veterinarian is paramount at that particular point.
All right, we're going to have to move on.
Thank you.
Thank you.
Thank you.
Thank you for your testimony. Appreciate it. I will read in the rest of the cards. Patrick, not wishing to speak, who is also opposed to the bill. Patrick Glidden with Lakeville Animal Clinic in Sterling Heights. Not wishing to speak, is supporting of the bill. Jared Skorup with Mackinac Center for Public Policy. Not wishing to speak, who supports the bill. Ann Griffin with Michigan Humane. We will go at ease. Yeah. The committee will come to order. Thank you, everyone. I would like to, I'm sorry. I'd like to report this bill. Rep. Young makes a motion to report this bill. Hearing no objections, will the clerk please take the vote?
On the motion to report House Bill 4980, Chair Miller,
Yes.
Representatives Pais,
Yes.
Young,
Yes.
Kofia,
Yes.
Conlon,
Yes.
Devendorf,
Yes.
Fitzgerald,
Yes.
Reingen,
Yes.
Nyer,
No.
Vanderwall,
No.
Roth,
Yes.
Beerline,
Yes.
Smith.
No.
Madam Chair, you have 10 yeas, 3 nays, 0 pass. The motion prevails.
Thank you, everyone. There being no further business before the committee and no absent members, the committee will stand adjourned. Thank you.